Hi, Dr. Strobel. I'm Malini. I'm the Senator's Legislative Director. It's nice to meet you.
Hi, Malini. It's terrific to meet you as well. And I just wanted to start off by thanking you and the Senator's office on behalf of the Society of Thoracic Surgeons for all the work you've been doing for our patients, and especially for your help in passing a 21st Century Cures Bill.
Well, thank you. I'll pass that along. Unfortunately, the Senator regrets that she can't be here today. She had to step out to take a vote, so it'll be just you and me. I do see from my notes that you've got a long list of topics to talk about. What are your priorities?
Absolutely. Well, I'd say our main priorities for today are the alternative payment model development, as well as sponsorship for S1301, the Resident Physician Shortage Reduction Act.
Okay. Well, I know APMs are part of MACRA, is that right? And the other option would be MIPS, is that correct?
Yeah, you've got it. With MACRA, Congress clearly intended for surgical specialties to be able to develop their own APMs. I've got a one-pager in my folder here that shows the exact section of the bill, if you're interested.
Okay.
However, based on CMS's implementation efforts so far, we're concerned that we won't have a seat at the table to get our APM proposals approved and successfully move our healthcare system away from fee-to-service and towards value-based care. We'd like Congress to keep an eye on CMS to make sure they're implementing MACRA according to congressional intent.
I see, okay. Do you know how many APMs are currently approved, and are there any APMs that CMS has developed that STS members could join right now?
Yeah, so I'm not exactly sure about that off the top of my head. I do think I remember something about a recently released CABG APM. I'll make a note to ask our government relations staff, and they'll be sure to provide you that information quickly.
Great, that would be really helpful. From what I know about the Senator's priorities, we might be interested in joining or even leading a Dear Colleague letter on this issue. So definitely keep me in the loop and get back to me. And what was that bill that you mentioned?
Absolutely, that was Senate Bill 1301.
Okay.
I noticed the Senator was a co-sponsor last year, and I appreciate that, but hadn't signed around on this time already. So I wanted to highlight it. As I'm sure you know, many reputable studies have predicted a massive physician shortage by 2030. Cardiothoracic surgery will be hard hit as the population ages and requires more care, as well as older surgeons retire, and the workforce is hindered by a cap on residency slots dating back from the 1990s. This bill would raise that cap so we can train more cardiothoracic surgeons to meet the increasing demand.
Is that kind of a magic bullet? I mean, what if the studies are wrong? I hear your concerns, but I think, as you know, my boss is very concerned about entitlement spending and really just spending money that we don't have. The Senator is very supportive of teaching hospitals, but I think, as you probably know, Medicare already provides roughly $10 billion a year towards GME, and we want to be certain of what taxpayers are getting for that money.
Absolutely, and I really do appreciate the Senator's concerns with regards to the funding side. And it's true that the Resident Physician Shortage Reduction Act only tackles the supply side of the problem. And there are several other areas of concern that I think myself and the Senator would have some common ground on that I'd be happy to send you information about. But for now, I really see raising the Medicare cap as a direct way to face this emerging problem, and as the first step amongst many in addressing it. And I can also send you the studies that I referenced. I know that the team in DC, as well as many of my colleagues, finds them very convincing. And as for your last point, again, to circle back, I do have some data here on what the economic impact of GME cuts would be for the community, particularly since, as you know, we are among one of the largest employers in the district.
That would be great. Those studies would be really helpful. I can ask my boss about this, especially because, as you know and mentioned, she did co-sponsor this last time.
Fantastic. I really appreciate it.
No problem at all. Well, really, thanks so much for coming in, Dr. Strobel. I've really got to go now, though. Do send me that information. I'll make sure it gets to the Senator's desk.
Absolutely. Thank you, Molly.